Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Meperidine. Its brand name is Demerol. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Meperidine is a narcotic analgesic whose effects on the central nervous system and smooth muscle organs resemble those of morphine. It primarily acts as an analgesic and a sedative. In terms of indications for use, it can be used as an adjunct for anesthesia. It can be used as a pre-medication before a procedure. It can be used to treat moderate or severe pain, as well as obstetric pain. Now, before somebody was to use Demerol, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. It would be contraindicated in patients who have significant respiratory depression. It's also contraindicated in patients who have acute or severe bronchial asthma who are in an uncontrolled setting without appropriate resuscitative equipment available. Patients who have used a monoamine oxidase inhibitor in the previous 14 days would not be able to use Demerol. It would be contraindicated in patients who have a known or suspected gastrointestinal obstruction. And finally, it would be contraindicated in patients who have a hypersensitivity to meperidine. Now, in terms of precautions, meperidine is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. There would be an increased risk of experiencing delirium when the elderly population uses Demerol, and there are other safer options that they can try before this medication. There would also be impaired psychomotor function, and we would be concerned about falls, which could result in fractures. The diagnosis or clinical course of acute abdominal conditions that patients may be experiencing could be obscured by the use of Demerol. Patients with alcoholism may be at an increased risk of tolerance, dependence, or addiction. Patients with certain respiratory conditions such as COPD may notice a decrease in respiratory drive as well as an increase in airway resistance. There would be an increased risk of toxicity if Demerol was given to a patient experiencing CNS depression or in a coma. Crushing, chewing, snorting, or injecting the tablets may cause an overdose, which could be fatal. A dose adjustment would be recommended in patients who have severe hepatic impairment. Severe hypotension may occur in patients using this medication. This would be more common in patients using the medication just after a surgery, as well as in patients who have a compromised ability to control their blood pressure. Dose adjustments are recommended to be made in patients who have hypothyroidism, as well as severe renal impairment. It should be noted that the long-term use of opioids may cause a decrease in sex hormones. Potentially life-threatening serotonin syndrome has been reported. This would be more common in patients who are also using other medications that affect serotonin levels. Patients with severe pulmonary impairment would be at an increased risk of toxicity. Demerol may cause new or could aggravate seizure disorder. And finally, it would be recommended not to stop the medication abruptly, as withdrawal symptoms may occur. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using meperidine or Demerol, they can expect to receive their dose either by injection, they can get it intravenously, or they may take a tablet. The initial dosing for the tablets would be 50 to 150 milligrams every 3 to 4 hours as necessary. The dose would then be adjusted based on pain control and side effects that the patient is experiencing. We always want to use the lowest possible dose for the shortest duration of time, as long as it's consistent with the patient's therapeutic needs. When stopping the medication, a good strategy would be to decrease the dose by 25 or 50% every 2 to 4 days. If signs or symptoms of withdrawal were to appear during this taper, you would just jump back to that previous dose that you were using and not experiencing those withdrawal symptoms. As with all medications, there are some adverse reactions or side effects that patients may experience while using Demerol, so I'll list some of those here now. Sweating, nausea, and vomiting have all occurred in patients using this medication. Some patients experience dizziness or lightheadedness, and some feel sedated. Some more serious side effects would be cardiac arrest, adrenal insufficiency, anaphylaxis, a raised intracranial pressure, development of a seizure, and finally, serotonin syndrome. That's all we're going to talk about today with meperidine or Demerol. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.